Welcome to the laseroptek webinar. My name is Jimin Seo. I'll be the host for today's webinar. Today's talk is entitled Treatment of Pigmentary Disorder with Helios 3. This presentation includes a Q&A session with our guest speaker. Please leave a question or comment to our guest speaker using the question tab on your screen. Helios 3, which will be mentioned during the presentation, is a Q-switched anti-arc laser. The specifications of the Helios 3 are in this slide. It has dual wavelengths of 1064 and 532 nanometers. Also has various modes including real twin pulse and 300 microsec free running mode. In addition, Helios has various handpieces including DOE handpieces. Using a variety of modes and handpieces, clinicians can treat a variety of lesions delicately and effectively. Dr. Tae Kim is the guest speaker for today's webinar. He is a dermatologist at Noble Dermatological Clinic in South Korea. He trained at Brigham and Women's Hospital in Boston, USA, completed GETC at Harvard Medical University. He is former director of Aramdao Nara Clinic in South Korea, former president of Sunsu Skin Clinic, former director of JK With Me Plastic Surgery and Dermatology in Korea, former president of Miso and Dermatology and Plastic Surgery. Also, he is a member of the Korean Dermatological Association, Korean Society of Aesthetic Surgery, Korean Society of Acne Research, Atomic Dermatitis, Hair Research. He is a member of International Society for Dermatological Surgery and member of American Academy of Dermatology. Now I will turn the mic over to Dr. Kim.
It's my pleasure meeting you. My name is Tae Kim, working at Noble Dermatology Clinic in Korea. First of all, I hope that everyone to keep safe and overcome through this tough period due to the coronavirus state. The main topic for today's presentation will be treatment for pigmented lesions with Helios 3. You will all be familiar of the treatment with the Q-switch and the arc laser, as it is one of the most basic devices for treatment in dermatologic clinics. But I would like to share and advise for some tips which I have received through my experience. Helios 3 is composed of with the basic wavelengths of 1064 and 532 nanometer and has two different pulse duration of the Q-switch mode and long pulse mode, which is 300 microsec. 1064 nanometer is basically used for the treatment of dermal melanocytosis, and 532 nanometer is effective to treat for epidermal pigmentation. Basically, for the Helios 3, they have the zoom handpiece, which is Gaussian mode, top head mode collimator handpiece, and two different fractional handpieces. Also, they have optional 585 dye handpiece and 650 nanometer handpiece, and two different modes, which is a single pulse and twin pulse called the RTP. Gaussian mode is more efficient for higher efficacy at lower energy, but can lead to side effects such as hypopigmentation. However, in order to prevent these side effects, when I use the zoom handpiece to treat dermal pigmentations, take eye handpiece to the skin. Furthermore, if you use the 585 dye handpiece with toning technique, it will show excellent results for redness. To look in more details of the fractional handpiece, they adopt the DOE technique, which can make very equal fluence at density for each spot. In the case of using the fractional handpiece, it has an advantage to protect the epidermal layer of the skin and reduce the risk of causing side effects. Also, Helios 3 has the thermal lens compensator, which can control the stability of high energy output and create a flat top beam profile. This is the RTP mode, which divides the single pulse output into half to reduce the peak power and the risk of side effects. Normally, the FR mode, which pulse duration is 300 microseconds, is used for skin rejuvenation, which is commonly known as the Genesis technique. Let's talking about pathogenesis of melasma. Firstly, external stimulation, such like UV, directly and indirectly affects melanocytes and keratinocytes to induce melanogenesis. Second is the role of the estrogen. Estrogen combines with estrogen receptor, which is on the melanocyte, and induces melanogenesis. Third is the interaction of fibroblast, keratinocyte, and melanocyte. We can predict through this interaction that melasma is related to the condition of the dermis. Finally, MIL675, which is the microRNA, directly and indirectly induces the melanogenesis. As you can see on the left side, the graph is showing the absorption curve of each chromophore. Choosing the pulse duration is as much as important to choose the wavelengths according to the chromophore which you will target. For effective treatment, pulse duration should be sufficiently shorter than PRT. Also, it will be much helpful if we know the approximate PRT for each chromophore. Therefore, for the tattoo removal, we can predict that the picosecond pulse duration is more advantageous than the nanosecond lasers. Next, we will check about the mechanism of laser toning for the treatment of dermal pigmentations, such as melasma. The main concept is subcellular selective photothermolysis, and I will briefly review the following the two papers. In the first paper, we can observe the complete removal of melanosome when irradiating with over 0.4 joule by increasing the energy with 1064 Nd:YAG to zebrafish skin. After 2 nail stain to check the cell apoptosis, we can secure the result to selectively destroy the melanosome with 0.4 joule without the apoptosis. You can guess that this is the proper strength to suppress the PIH. This is the paper to observe the structural change of the melanocyte and melanosome through the electron microscopy after treatment with the QSNY laser. When compare the before and after irradiation, you will realize that the total amount of melanosome has been reduced. However, there was not much effect to the immature stage 1 and 2 melanosome, but the mature stage 4 melanosome, which is spread on the dendrite, has mostly disappeared, which shows the effect such as dendrectomy. Based on these experiments, we can infer that the goal of laser toning should be eliminate maximum melanosome within the extent that it doesn't cause necrosis or apoptosis of the melanocyte. This is the paper showing the melasma treatment to compare with the Nd:YAG and ruby laser. Following the results, Nd:YAG shows better maintenance and recurrence rate as less degenerative change compared to the ruby laser. Furthermore, we can realize that the Nd:YAG can effectively delay the melanogenesis during the remodeling process. Next, I will introduce melasma treatment. For melasma treatment, I have 3 personal principles. First, relax my mind. Second is to avoid side effects. Third is combination treatment if allowed. The treatment method is based on laser toning and applying medicine for 1 to 2 weeks, and if necessary, we focus on lesion therapy mixed with tranexamic acid and PDRN. There are many melanogenic inhibitors, and I don't prefer hydroquinone, retinoid, and corticosteroid combined therapy called Krigman method, which is most powerful in terms of effectiveness, but it often gets worse when there has stimulated react. Instead, I usually use 5% albutin and 20% azelaic acid, which have good compliance. Especially in case of patients who got the melasma with pimples, the azelaic acid is considered the first line. Tranexamic acid can also be a major cure. This mechanism inhibits the transition of plasminogen to plasmin, thus inhibiting breakdown of clot. It is recommended to take at least 2 pills a day because there is dose dependency. From the point of view of melasma treatment, tranexamic acid as plasmin's activation inhibitor can be a usable tool because plasmin activates melanocyte through the arachidonic acid, alpha MSH, and BFGF, and causes angiogenesis through VEGF. But it is contraindication if there is a history regarding deep vein thrombosis. PDRN can also be used as injection therapy inside lesions. This reduces the wound healing effect and cytokine levels to reduce MITF, which inhibits melanogenesis. Why I choose Helios 3? Because the NDR laser is basic device. It should be easy to use, has fewer failures, and has good durability. The reason why I chose Helios is because the user's reputation for these skills was so good. I enjoy using the rotation method during toning. RTP mode, zoom handpiece, fractional handpiece, and 585 die handpiece are treated in one session and treated in FR mode once more with Genesis technique. Let's see results of treatment. I decided to launch Mark View system to investigate clinical results. It has 4 light sources. Normal light is usually used for pores, wrinkles, and skin tone. Glossy light for pores, wrinkles. Polarized light for pigmentation and redness. UV light for melanin, sebum, and porphyrin. "35 years female with melasma showing improvement after 10 sessions of laser toning. "41 years with melasma after 20 sessions. Now she is in a stable state. "50 years with severe type of melasma after over 20 session treatment. 2 months later, 5 months later, and 12 months later, she reached stable state. "35 years with lentigo. Disappeared after 2 sessions of 532 NDR. Another portrait of melasma showing improvement after 3 months. This is a case of acne redness combining with 1450 nanometer diode laser shows excellent results. Melasma with lentigen showing improvement after 532 and laser toning. 50 years with melasma showing improvement after 12 months. She continues laser toning to keep pace. "27 years with freckles can be easily removed by 532. "32 years with nevus ovata showing improvement. 6 months later. Treated by 1064. This is a case of generalized flushing with 585 dye laser toning technique showing excellent results. It's also a flushing with a good results. "45 years female with melasma showing improvement after 10 sessions of laser toning, with the UV light showing improvement. 41 years with the same condition and lateral view showing improvement. 49 years with melasma shows improved results through laser toning, lateral view, and UV light showing improvement. Keep going with a similar condition. Same. Melasma has been improved. Same condition has been improved. UV shows improvement. She's 23 years with freckles. Can be easily removed by 532. Same condition. Showing good results. Same condition. As you can see, there is still remaining melasma. UV light. This is melasma with lentigen showing improvement after 532 and laser toning. This is a woman with a lentigo eliminated by one session of 532. This is UV light. Woman with a lentigo with one session showing improvement after 3 months and almost cleared after 12 months. 10 months, I'm sorry. UV light showing improvement. Generalized flushing can be improved by 585 dye handpiece laser toning technique. Woman with rosy cell showing improvement after dye handpiece with laser toning. This is the same condition. This is a case of acne redness combining with 1450 nanometer diode laser shows excellent results. UV light show improvement. Same condition. same condition. Treated by dye handpiece, acne readiness has been cleared. In conclusion, Helios 3 can effectively treat dermal pigments such as melasma, nevus of aorta, and epidermal pigmentation such as freckles. Also, it is effective well the acne readiness mark and vascular regions such as diffuse erythema. Thank you for listening.
Thank you, Dr. Kim, for sharing your clinical experience using Helios 3. A number of questions have come in during the presentation. The first question is about lentigo treatment. Will you choose 532 or 1064, or you use both?
Epidermal type of lentigo can be easily removed by 532, but if it is deeper, then I can use 532 and as well as 1064.
Okay, and for melasma patients, do you recommend to use the laser toning? How many passes do you perform, and how many sessions patients normally need?
Patients usually need at least 10 sessions every week, and it depends on patients, but usually I use 3,000 shots in every session.
Okay, and can you tell us about the treatment protocol with FR mode, like spot size and endpoint?
I usually use a collimator handpiece. This is 8 millimeter diameter. Endpoint is the longer is better, but I usually use 3,000 shot.
Okay.
Yeah.
And do you use other parameters apart from laser toning for melasma patients?
When I treat melasma with the laser toning technique, I usually use collimator handpiece and energy with full. It means RTP mode can be 2,000 millijoule, but I always contact the skin, contact the handpiece to the skin.
Okay. And this is a slightly different question. How many sessions needed for nevus of aorta treatment?
It really takes time. So I always tell my patient it will over a year, at least over a year.
Okay. For lentigo treatment or other pigment treatment, can you tell us about the protocols again with your before and after photos? The treatment protocols that you showed us with the before and after photos.
532 nanometer handpiece. I start at the level of 0.4 with 3 millimeter diameter. And when treating nevus aorta or tattoo removal, I usually use 4 millimeter with the zoom handpiece, and starting 1.5 joule.
Okay, and can you tell us about the time interval between treatment sessions for melasma or aorta of nevus?
The treatment interval of melasma is shorter than other lesions, maybe 1 or 2 weeks. But in case of freckles, it should be longer than melasma. So it needs about 2 months.
Okay, 2 more questions. How many months do you usually prescribe tranexamic acid for?
I usually prescribe 3 months, then check the results if it's necessary. So once more, I prescribe the tranexamic acid once more.
Okay, and how many times a month can we treat melasma with the PDR?
The melasma is severe. Then every week, I treated melasma every week with PDR injection.
Okay, so I think this is it. So it's time to wrap up. So today's webinar will be accessible in a week from our website. Also feel free to contact us if you have any questions or requests via the address shown on this slide. Several webinars will be held throughout May and June. The next one is on June 4th, Korea time. Please check the schedule on laseroptek's website and social media. A big thank you to our guest speaker, Dr. Kim, for his great presentation. Also, thank you to our audience for joining us today.
Thank you.